When discussing how to address needs for people on the autism spectrum, there are two models that people may reference. The first is the medical model, which describes a condition such as ASD as a set of deficits or impairments that need to be treated, cured, or eliminated. Individuals with those deficits cannot overcome barriers that others can. As a result of those barriers, the medical model suggests people on the spectrum must go through various interventions to reduce any signs of deficits. In recent years, there have been controversies surrounding the medical model. This specifically includes the interventions that are endorsed. Conceptually, the purpose of these interventions is to reduce any behavior that could be problematic, such as self-injury. Specific interventions, like speech and language therapy, can also be used to develop new language and communication skills for people on the spectrum. Although, interventions can become harmful to the individual if the goal is to make the person less likely to be perceived as autistic, or in other words, indistinguishable from peers. This includes going as far as eliminating some autistic behaviors that are not only harmless, but also beneficial, such as self-stimulatory behaviors like flapping hands. As a result, extreme interventions could present a social stigma among people with conditions like ASD. In response to the medical model, a second model is becoming popularized to change how autism should be perceived. The social model, or sometimes referred to as the neurodiversity model, explains that rather than saying an individual is disabled by their abnormalities, they are challenged by their various barriers. This includes attitudinal barriers, environmental barriers, institutional barriers, and communication barriers. Here are some ways how the social model could be implemented into certain environments. For schools, the social model could be achieved by teaching students about common social behaviors seen with people on the spectrum. This will give students a better understanding of how to develop friendships with autistic people. As for the workplace, organizations should incorporate custom methods for neurodiverse hiring. Because social communication tends to be a common challenge for people on the autism spectrum, one thing that can be done is decrease the reliance on interviews to determine the value of the applicant. As a substitute for interviews, providing assessments may help provide a better demonstration of an applicant's skills. Of course, the social model is not supposed to replace the medical model, as interventions may be needed if individuals on the spectrum have specific difficulties that need to be addressed. However, by incorporating this new model into various environments, we can find ways to accommodate people on the spectrum for a better quality of life, and by doing so, society can evolve.